So it seems like a new disease here, huh? It's called Hashimoto thyroiditis.
Hashi what?
Hashimoto thyroiditis.
Oh, I think that would be Hashimoto thyroiditis.
Oh, you know about this disease?
Yes, it actually affects about 14 Americans, and it's more common in women than in men.
Oh, really? I think I know a little bit about too. I know actually about the doctors. Oh, the doctor is actually a Japanese doctor, and in 1912, this Hakaru Hashimoto, which we're talking about, he described the patients with a chronic endocrine gland disorder of the thyroid as having like stroma lymphomatosa because of the diffusions of the gland, and that actually has the clinical and the pathogenic studies of the disease has appeared like really frequently, like in Japan. So he named this disease as Hashimoto thyroiditis.
Thyroiditis.
Okay, so what and how I the only symptom that I know is that they have really thick neck, right?
Yes, they have thick neck, and it's called goiter. It's the enlargement of the thyroid gland, and there are some other symptoms associated with it.
Oh, really? They
Yes,
have like other symptoms?
yes, many symptoms.
Oh, so what are they then?
It's fatigue when children or adults cannot function in class. They can't pay attention
Oh,
because they're tired all the time.
okay. Anything else?
Yes, weight gaining is seen in people with this condition.
So you're saying like people gain a lot of weight?
Yes, because their thyroid gland is not functioning correctly.
So is that it? That's not really a serious problem then.
Oh, it is a serious problem. There's more other symptoms associated with it. Uh, learning disorders or learning problem, not really a disorder, but just they can't seem to learn things the right way, and they are dry and itchy skin, sore muscles, increased sensitivity to medication.
Sounds like a lot of symptoms there. Um, I think we can say that's a serious problem, right?
Yes, that's a very serious problem. And like, what happens with the thyroid gland exactly? What is the thyroid gland?
Oh, you are talking about the thyroid gland here? Okay, thyroid gland is actually like the second unit of like a thyroid follicular cells like gland. They actually enclose like they compose with the thyroid globulin. There are like two kind of hormones they secrete. Like there's like a T3 which is called the triindo threonine, and there's another one called T4 which is thyroxine. These are actually the primarily calorogenic effects on many tissues, which there are mostly like oxygen
Oxygen.
consumptions. Yeah,
Yes.
yeah, and we need that. We really need that when we're growing up. We need to develop, and it also works on like sexual maturations in mammals as well. Um, I know how it functions a little bit. Is that the regulation of the thyroid is actually began with the thyroid triple releasing hormone that is secreted by the hypothalamus, which is in our brain, and
Yes.
it is acting on the pituitary glands to stimulate the synthesis release the TSH, which is short for thyroid stimulate hormone. The TSH binding to receptors of those thyroid glands, and they will break down the thyroid globulins, and they will stimulate the free like T3 and T4. Then the T3 and T4, they will also add like rising the circulation levels of our glucose, and they actually will increasing the glycolysis or glycogenesis and intestinal absorption of glucose. This is what happens. So how is this Hashimoto disease related to thyroid?
All right. Since we have a reduction in thyroid hormone, which means that our body is not getting enough of this hormone, which causes us to have all these malfunctions, like fatigues and stuff like that.
Okay.
But when we talk about how it's related to the immune system, since it's an autoimmune disease, what happens is your body attacks its own immune system, attacks its own thyroid gland.
I think that's why they call it autoimmune disease.
Yes, yes. Your T cells specific for the thyroid gland cells create B cells which are release antibodies that are specific for the thyroid gland.
Okay.
Okay, when it does that, those B cells will go and attack the thyroid gland, and the thyroid gland would not function.
So they are considered as the antigen of our bodies now, right?
Yes, the thyroid gland will act as the antigen. The thyroid gland cells will be the antigen, and your body will be producing antibodies against its own thyroid gland, and thereby you see a decrease in thyroid hormones in the body.
Oh, that's why people are not functioning well. Probably that's why they gain weight.
Yes. Actually, we see a high titer in one of the three people affected with this autoimmune disease, and these cells are associated with leukocyte antigen DR4 and DR5.
Oh,
A lot of studies have shown that people with diabetes are more likely to have this condition compared with normal human beings. And the T cells are the ones who are responsible for initiating the immune response in type 1 diabetes as well as Hashimoto thyroiditis.
oh. Since it works in this way, I think that there must be like a lot of like diagnosis tests specifically for it. If it is for T cells, the first thing they probably remind me is we can do actually hypersensitivity, like the
Like an assay?
Yeah, like we can do an like a radio assay, or we can do like an immunoassay on it. I think I have heard that there is one test. It's called the high sensitivity thyroid stimulation hormone assay. It's considered to be like the gold standard laboratory test for identify the thyroid abnormalities. But it's really like it is really useful. I've heard of that. I think there is other assays. There's one. This is one called like the total T4 assays. Since we know that because the thyroid is not functioning well, so the T3 and T4 is going to be the releasing of those hormones going to reduce. So what we're going to do is detecting like T4 bind to the protein and the free biological the actual T4. So that's what, and then we can measure the reflex of the physiological effects of the hormone better than measure the total hormone, because the T4 binding with the protein is a test of choice as an indicator of the thyroid status. There's another one actually really is also really good. It's called the TPO antibody assay. This is actually the most sensitive and specific. Have you heard of that? It's actually like a high volume testing of the radio immunoassay enzyme like immunoabsorbance assay. This is we are using the antibody. This antibody can be demonstrated by the hemagglutinations.
Yes.
Alright, now I'm going to talk about treatment. In order to treat Hashimoto's disease, levothyroxine replacement therapy is used. During Hashimoto's disease, there is this antibody that works against thyroid peroxidase, which converts T4 to T3 and synthesis process, due to which serum level of T4 and T3 is constantly dropping, and in order to compensate the T4 and T3 level, TSH is constantly being stimulated, which makes us have more hypothyroidism and increases the level of goiter. And what does this drug does, it is brings back the level of T4 and T3 and reduces the goiter, treating the diseases. On the other hand, if the replacement therapy does not work, surgery can be done. While there is a consequences of surgery following pain and disfiguring and pressure in those thyroid region. Alright, in conclusion, we already know Hashimoto's is an autoimmune disease and most common cause of hypothyroidism. Patients with Hashimoto's have enlarged goiter followed by hypothyroidism, as well as it is initiated by different antibodies such as anti-thyroid peroxidase antibody, anti-thyroglobulin antibody, anti-thyroid stimulating hormone. Therefore, we could do high-sensitive TSH assay along with the chemi-illuminometric assay, and if we see a high titer of any of those antibodies above, that indicates the presence of Hashimoto's disease. And we could also treat the patient with, as I said, with the replacement therapy and surgery. So this includes the whole Hashimoto's disease.
Okay. Thank you for watching this video.
Thank you.
Thank you for watching. This is our first time making a video, so you have fun.
The end. Yes, there's a lot of treatments, and